prior to dilution, the thawed dispersion may contain white to off-white opaque amorphous particles. The multiple dose vial contains 6 doses of 0.3 milliliter of vaccine after dilution. Strict adherence to aseptic technique must be followed. After thawing and prior to dilution, ensure the vial is at room temperature and not cold when touched. Invert gently 10 times to mix. Do not shake. Use sodium chloride 9 mg per milliliter 0.9% solution for injection for use as a diluent. Using an alcohol swab, cleanse the vial stopper of the diluent. Draw up 1.8 milliliter of diluent with a syringe with an appropriate graduation and a 21 gauge or narrower needle. Recheck the label prior to use to ensure the correct diluent is used with the vaccine. Do not add more than 1.8 milliliter of diluent. Using aseptic technique, cleanse the vaccine vial stopper with a single-use antiseptic swab. Then dilute the thawed vial of the vaccine by adding 1.8 milliliter sodium chloride 9 mg per milliliter 0.9% solution for injection into the vial. Do not add more than 1.8 milliliter of diluent. A syringe with an appropriate graduation and a 21 gauge or narrower needle should be used. Be mindful of guidance on precautions to prevent unintended exposure. The biggest risk for unintended exposure is through openings in the skin from a cut or needle stick and mucous membrane exposure from aerosolization. This is most likely to occur when diluting the vial for dosing or withdrawing the needle from the vial. You may feel some pressure in the vial as you add the diluent. Ensure vial pressure is equalized by withdrawing 1.8 milliliter of air into the empty diluent syringe before removing the needle from the vial. After dilution, the vaccine will be an off-white dispersion. The vial contains 2.25 milliliter, corresponding to 6 doses of 0.3 milliliter. Inspect vials to confirm there are no particulates and no discoloration is observed. Use a separate sterile needle and syringe for each individual. It is not necessary to change needles between drawing up the vaccine from a vial and injecting it into a recipient, unless the needle has been damaged or contaminated. Gently invert the diluted vial 10 times to mix. Do not shake. Dilution of the vaccine will result in an off-white dispersion. The diluted vials should be marked with the appropriate date and time. Store diluted vaccine between 2 to 30 degrees Celsius. Expiry is 6 hours from the time of dilution. If not used within 6 hours, it should be discarded. To prepare individual doses, start by cleansing the vial stopper with a single-use antiseptic swab using aseptic technique. Draw up 0.3 milliliter of the diluted vaccine into a new sterile syringe appropriate for intramuscular injection. Low dead volume syringes and/or needles with a combined dead volume of no more than 35 microliters are recommended. If standard syringes and needles are used, there may not be sufficient volume to extract a 6th dose from the vial. Use safe sharps handling techniques to avoid needle stick. Adjustments to remove air bubbles should be done with the needle still in the vial to avoid loss of vaccine. It is recommended to use the same needle to withdraw and administer a single dose whenever possible. If a second needle is required for administration, pull back on the syringe plunger until a small amount of air enters the syringe prior to removing the first needle to avoid loss of the vaccine during the needle change. For each additional dose, use a new sterile syringe and needle and ensure the vial stopper is cleansed with antiseptic before each withdrawal. Be sure to immediately dispose of used needles in a sharps container. Make sure the prepared syringe is at room temperature and not cold to the touch. Do a visual inspection to verify the final dosing volume of 0.3 milliliter. Each dose must contain 0.3 milliliter of vaccine. If the amount of vaccine remaining in the vial cannot provide a full dose of 0.3 milliliter, discard the vial and any excess volume. Do not pool excess vaccine from multiple vials. Prepared syringes should be administered immediately. Administer the vaccine intramuscularly. The preferred site is the deltoid muscle of the upper arm.